Today we are doing a functional mobility assessment. A functional movement and mobility assessment will demonstrate movement patterns that produce pain within expected ranges of movement. Additionally, it will identify individuals with non-painful but limited movement patterns who are likely to demonstrate higher potential risk of injury with exercise and activity. Finally, it will identify specific exercises and activities to avoid or give assistance with until competency or strengthening in the required movement is achieved. Assessment of fundamental functional movements can help determine who possesses or lacks the ability to perform a wide variety of essential everyday movements. The greatest risk for falls is a history of falls and dysfunctional mobility. Functional mobility testing should examine patients under conditions that imitate the necessary functional demands of their life at home or in the community. Skeletal muscles change with age. They decrease in size and atrophy over time, which means their strength decreases. It's this decline in muscle and strength that is strongly associated with increased risks of falls and physical disabilities in older adults. Here today to assist with the functional mobility assessment is Mr. Richard Abbott. He's 90 years old, a retiree with congestive heart failure, and he is 1 month status post a transcatheter aortic valve replacement. He is on digoxin, Eliquis, metoprolol, and torsemide. Mr. Abbott, thank you for being with us today.
Glad to be here, Ms. Beninghove.
As we begin our functional mobility assessment, I'm going to ask you to do certain things. If any of those activities cause you pain or discomfort, if you feel dizziness or lightheadedness, I want you to tell me right away, and we'll stop the activity.
Yes, ma'am.
I also know that your aide is here, and she's going to be assisting us as we move through these activities as well. Okay?
Yes, ma'am. That's
Right.
fine.
We've already taken Mr. Abbott's vital signs. They are stable, and so we're now ready to proceed. Mr. Abbott, I'm going to ask you to first try to cross both of your legs. One right over left, left over right for me. Right over left. Okay, any pain? All right, left over right doesn't go quite as well, does it? Why is that, sir?
I don't know. It's been like that for years.
Okay.
It's been like that. I've never been able to cross my left over my right.
Okay, so definitely limitation in the left over the right.
Exactly.
Okay.
Yes, ma'am.
All right. Now, are you able to lift your hands above your head?
Yes, ma'am.
Is there any pain or discomfort?
A little in my left shoulder, ma'am.
Okay. Tell me what a little means.
If we were going to 1 to 10, it might be a 3.
Okay. Excellent. Excellent. Are you able to tolerate some activities with your arms as I ask you to do them?
Yes, ma'am.
All right. So you let me know if there's any discomfort. The first thing we're going to do is have you to stand. I want you to stand up and sit down 5 times in a row. A little bit of imbalance on that one. Good. And this time, stand up all the way straight and stay standing. All right, a little bit of swaying there when we start. All right, if you'll close your eyes, please. Uh-huh. Okay, there we are, a sway back and forth. All right, keep those eyes closed. Now, put both arms out to the side, straight out like a tree. There you go. Definite swaying there. Back and forth. All right, so right hand to your nose. Out again. Left hand to your nose. Out again. All right. Hands down by your side. You may open your eyes. All right, I'm going to ask you now to walk across the room and back 3 times, increasing your speed as you feel comfortable. Do you have any pain currently?
No pain, just weakness in the legs, but no pain.
Okay, so your aide is here and I'm here in case there's any weakness or you feel like you're dizzy or going to fall. You let us know immediately. Of course, we'll be right here with you.
How many times?
3 times, sir.
Okay.
To the door and back 3 times, as well as you can physically feel like you can increase in speed as you go.
All right.
All right? All right, pick up the speed like you normally would for me. I want you to do a little faster. There we go. Now, pick it up and you'll see the lean to the left when he walks. There's a very big lean. Okay? One last time. Okay, all right. Don't sit. What I'm going to ask you to do now is, if your aide will please give you your cane, which I know you're supposed to use most of the time. Tell me why there are times when you don't use your cane.
I don't use it in the house
Why is that?
primarily because, as you can see, I walk fairly well. And I can go, and there's plenty of furniture in my bathroom. I have rails beside the commode. I have the handrail going to the kitchen. There are many things I can hold on to.
So we call that a really technical term, a furniture ambulator, right?
That's exactly right. I'm a furniture ambulator.
Okay. All right. So now I'm going to have you take your cane and do the same 3 laps, but use your cane.
Okay.
Notice that his stride is much longer using the cane. He also is not coming off to the left when he turns or when he moves. The cane makes a huge difference for him to be able to utilize that cane. He's also holding his trunk upright.
One more?
Yes, sir. There are times when he doesn't put the cane completely on the ground. All right. Thank you, sir. Excellent. Great. Thank you. All right. Now, we saw how you were able to get up, and when you did, you used the hands,
Yes.
the arms on the side of the chair with your hands to stand. We're now going to proceed into your living room. And I'd like for you to sit at the chair that's at your desk, which doesn't have arms. And that way we can see how that works.
Fine.
All right?
Mm-hmm.
All right, sir, no cane, but we're going to have it. Your aide's going to grab that for you. We'll have that. Yes, sir.
And how many times, Ms. Beninghove, do I go up and down?
Immediately he puts his hand on the desk. All right, sir, we're going to have you get up and down 3 times. All right. A little bit to the left when he sat down. There we go. And one last time. All right. How's your heart feeling right now? I know that you've just had that heart procedure 30 days ago, so is it beating faster? I know you have a pacemaker as well.
I don't notice that my heart is beating faster, but I do notice that my breathing is increased.
Yes, absolutely, and we've seen the same thing. I've noticed that your nose, the nares in your nose are actually spreading open further, and I know that's a compensatory mechanism that you're using to be able to help get more of that air inside.
Yes.
All right, do you want to sit for just a minute? Let me just check your pulse and make sure that you are... Yes, it is beating quite a bit faster, actually. right. Any pain?
No.
No discomfort?
No.
How do your legs feel?
Weak.
Still weak.
Yes, ma'am.
Okay. What I'd like to do now, sir, is to move to the recumbent bike that you have here at your house.
All right.
I know that therapy has already, you have to watch the toe on the edge of the chair. All right. Okay, as he uses the sofa, it's an excellent placement, sir, to put this right next to the sofa. And I know that you thought about that, and we had a little bit of discussion about placing it there. Why did you decide to put your bike right next to the sofa?
Because I do have a problem with my balance, and I sometimes had difficulty getting on and off with my balance, so this has been a great help.
And we saw that even when you got on. I'm not sure we were able to see it in the videotape, but you absolutely held on and kind of fell a little bit into the sofa. So, before your surgery, how long were you able to go on your bike?
I could go 15 minutes at the lowest level.
Okay. And then 1 month before your surgery, you were unable to even do the 15 minutes, correct?
I was doing 15 minutes before the surgery.
Right, but about a month before you had the surgery, which was during the month of December to January, you really had difficulty.
Yes.
You couldn't even do your bike.
That's right.
Okay. And what symptoms were you having before your surgery?
Really 15 minutes was a push. And after about 10 minutes, I began to get burning in my legs up through my thighs. And so it was a real push to get 15 minutes.
Okay. All right. I'm not going to ask you to do this now because I know that you're having therapy 3 times a week with where you go to outpatient therapy. So we're not going to stress that. What I'd like to do is have you come over to the stairs and go up these stairs, because I know personally how many times you go up and down these stairs every day, and we're getting ready to put in some assistance for you on those stairs.
That's great.
Okay, so why don't you come on over to the stairs? And your aid is at the top of the stairs, so go ahead. All right. You want to sit down for just a minute, or can you come back down?
I can come down.
All right, let's come back down.
Right.
There we go. All right, now, Mr. Abbott, I've known you for several years now. And actually, back in the fall, which was just 4 or 5 months ago, you did not take those stairs one step at a time.
No, I did not.
Okay. What was your normal gait like as you walked up those stairs?
You want me to demonstrate?
I don't want you to tax your heart.
All right.
All right. So, but you normally went up those stairs without doing one step at a time.
That's correct.
Correct?
That's correct.
Why are you now only doing one step at a time?
I have a great fear of falling.
And why is that?
Because I have a predisposition to falling.
Because you're off balance?
Off balance, yes, ma'am.
Okay. And these stairs have actually been sort of that spot on occasion when you have fallen, correct?
Yes. I have a stairway, 13 stairs, and I have an airlift up to it. But even before the chairlift, I had no problem. These are my nemesis.
Yes. And these are actually a little taller than what normal stairs would be. You know, you and I talk shop all the time, and we say these aren't quite to code, correct?
Yes.
And so one of the things that we're talking about currently, Juanita, if you would step into the area there and show where we're going to put the pole.
Right, yeah.
We're going to have a large pole that has sort of a B handle on it, correct?
Mm-hmm. Yes.
So that when you go to the top of the stairs, instead of holding on to the doorway, you're going to be able to hold on to that handle, and it's going to move with you as you move into your kitchen area, correct?
Yes, and that's going to be a big help, because while I don't stumble on the top step, I scrape my arm on the side because I lose my balance, so I scrape my arm.
Right.
So
Also,
that'll be a big step, big help.
absolutely. Also, the aide is not here with you only during the day.
That's correct.
So what happens when you come down and bring dinner and sit in front of the TV? What do your hands look like when you're doing all of that, trying to balance all of those pieces?
I don't. One of my instructors at my balance class told me, said, that I told him about the three. So you put your tray here, and you walk down, and then you get your tray. And I practice that.
It's an excellent compensatory mechanism in the home.
Yes, it is.
To be able to put a tray here with all your food, come down,
Right.
being able to hold on to the railing, then turn around, grab that.
Yes.
Okay. There are also times, however, even when you're reaching over to grab your tray, that it is a little nerve-wracking, correct?
No, because I'm here, and I have my tray, and I hang it over the edge.
Okay. So even here, that overextension of his waist and shoulders, as people bend over, our heads get exponentially heavier. So even that reaching, though it is a wonderful compensatory mechanism, could cause him to fall because his head is getting heavier as he bends. Plus, we already know about that left hip flexor and how tight it is. And therefore, that can make it another area where he could fall even just the slightest bit here. Once he picks up the tray, he's still got to traverse tile as well as carpeting. And then there's a lot of furniture that he has to go through. If we can show Mr. Abbott as if you're going to your chair in front of the television.
Yes, ma'am.
To show everything that we need to traverse there.
Okay.
So you're across there, becomes another surface with the carpeting. And then you're over there, you're going around chairs, you're going around a coffee table, you have your tray table in front of you, and then your chairs have wheels on them, don't you?
Yes.
That chair has a wheel.
Yes.
So that in and of itself could cause a fall. And I've seen that happen when you've gone to sit down, it's moved back a little bit.
Yes.
So, all right. Sir, is there any pain now?
No.
You're
Just
comfortable.
weakness.
Still just the weakness in
Yes,
your
ma'am.
legs. All right. Why don't you go ahead and have a seat for me? Functional mobility assessment in the home is primary to what we're able to do and how we're able to make sure that our patients are safe in their homes, in the environment in which they live.